Well, my name is Amy Thomas, and my background primarily is in ER. I've done a little bit of surgical, PACU, kind of nursing, but I've been a nurse for 13, 14 years, and waited a while before I went from associate degree to my bachelor, and then I got a master's actually in nursing education, and did a couple years after getting my master's, and really decided that I miss the clinical aspect. I do love to educate. I probably still will always educate, but I think the focus will be a little bit more on patient population now. So I was drawn to the DNP program because I already had a master's, and I felt that it was, I actually did a lot of research online, which a lot of us do, on different programs, and I like the concept that TU had of having on-ground as well as kind of a hybrid. We do some online classes, but primarily classroom teaching on a lot of the major things, subjects, and I like that. I like to have that interaction, and staff is available for us, and so it's kind of nice. I talked to quite a few and had experienced quite a few nurses when I was an educator that were in an NP program, and some of the downside of the online programs where you had to find your own clinicals, which could be very difficult. Things like mother and child, pediatrics are like almost impossible. So to find a site, and there's a lot of tears and going to far-reaching places to try to get clinicals, and I'm like, ugh, I just don't have the time to look all over, and so I kind of lean towards TU. Plus, it's a great school anyway, and I like they kind of gave you the rundown of what you're going to do, and I like the concept. DNP is kind of where I think things are progressing from the masters, and there's a lot of talk of in the future DNP will be the standard. So I figured this was it for me. I'm not going to go to school anymore, so I might as well do a DNP. Originally, I chose acute care because I really like geriatric and adult. I had a little bit of background I have a lot of background in peds in the ER setting, so there was a lot of maybe not good experiences with peds, so I was sort of like gun shy about the pediatrics. So I thought, well, adults and geriatric would be good. And I still do really like geriatric population, but I think that the F&P, I ultimately decided to do that because it's a lot more marketable. You see all populations across the lifespan, so you open yourself up to being able to work in urgent cares and getting a little bit more. You can specialize if you want to. You can get other certifications if you want after that and specialize a little bit more, but I think you get a broad range of experience across lifespan.